The question relates to pelvic floor exercises and how they can impact surgical results both by doing them before and or after surgery. So I advise my own patients to begin exercising the pelvic muscles well in advance of surgery. When we make the diagnosis of prostate cancer, we try to advise them to start the exercises. They're typically known as Kegel exercises. Women who've gone through pregnancy know these all too well. But essentially what is involved is contracting the muscle that would normally stop the flow of urine. And you don't do it while you're urinating. You might do it while you're urinating the first time just to identify the muscle. But once you've got to memorize what it feels like to contract that muscle, you squeeze it tight for 5 seconds, relax it for 5 seconds, and repeat that 5 times. And it's remarkably difficult to do. And it takes a lot of practice to be able to hold that muscle tight for 5 seconds. But if a patient will exercise that for 2 or 3 or 4 weeks leading up to their surgery, by the time they get to their surgery, they are actually able to hold the muscle at full tightness for 5 seconds. And so those patients actually notice an improvement quicker than patients who weren't up to speed prior to surgery. We also recommend for patients to do these exercises universally after the catheter is removed, whether they had started them before surgery or not. Kegel exercises do work. They can't overcome major muscle damage, but they can overcome minor muscle damage, and they can overcome the healing or the time period of healing where there is a weakness of the muscle, but the muscle ultimately recoups its normal function. So it will speed up recovery of urinary control and maintenance of urinary control if they're done religiously. We often send patients for specialized physiotherapy treatment to isolate this particular muscle group, so it's kind of like Kegel exercises on steroids, done with external monitoring to actually visually demonstrate how strong the muscle is contracting. So this is a way of getting feedback as to whether you're doing the right thing and whether you're showing improvement. For patients who do that, they will notice a significant improvement. It may not cure them. So Kegel exercises for patients who need them, which is most, have to be done as a continual thing, as a lifelong training program.